This is the Brown Emergency Ultrasound February case of the month. A patient who is 33 years old comes in to the ER. She's got no past medical history, and her chief complaint is of shortness of breath and right-sided chest pain. A lung ultrasound was performed at the bedside, which demonstrated what we call lung point sign. Lung point sign is something that you see in a collapsed lung or a pneumothorax. And you can see it looks almost like a lizard tongue here. This is what you find at the area where the lung which is collapsed meets the lung which is still inflated. So how do you evaluate a patient for a pneumothorax? What's your scan technique? I tend to take a linear probe, which is a high-frequency probe, place it in the sagittal plane, meaning marker pointing towards the patient's head, at the midclavicular line. And I like to interrogate 3 different spaces or 3 different intercostal regions to make sure that there's lung sliding in each of those spaces. Rebel EM did a really nice literature summary on this topic, which I've provided here. And what they looked at was the different studies which have been done to evaluate sensitivity and specificity of lung ultrasound for pneumothorax. And you can see that the specificity is quite good, ranging here from basically 97 to 100. So what are you going to see on an ultrasound if you have a pneumothorax? So you're going to see, most importantly, absence of lung sliding, and then you're also going to see absence of anything like the normal comet tails that you see in a normal lung. You also will not see B-lines in a pneumothorax. So a presence of B-lines actually excludes the possibility of a pneumothorax. And then you're going to see what we call barcode sign on motion mode or M mode, and we'll talk about that. So here's what you expect to see when you're evaluating the lung. Again, marker to the head, and you can see a rib pointed out with the arrow, and you can see posterior rib shadowing because the ultrasound beam isn't traveling well through that bone. In between those ribs, you can see the arrow pointing to the pleural line. So that's where the visceral and the parietal pleura meet, and they're shimmering back and forth relative to one another in a non-collapsed lung. And then closest to the probe, or closest to the top of this image, you're going to see the subcutaneous tissue or musculature of the chest wall. So if we look at the M mode, on the left-hand side, you can see what we call normal lung, and you can see the line that's drawn there, that white line. So when you put motion mode on, you're dropping a line down through an image, and then what you're doing is tracking the ultrasound data underneath that line and plotting it below over time. So you can see in a normal lung where the M mode line is over the chest wall, that chest wall is not moving, so it looks like barcode, or the lines are just going straight across because there's no motion. Versus lower down where we're beneath the pleural surface, the lung is moving and you're seeing positive motion, so the image is going to look different. We call that motion mode in a normal lung the seashore sign because it looks like waves crashing in on the beach. On the right-hand side, in contrast, if you drop your motion mode line down through the lung in a patient with a collapsed lung or a pneumothorax, you're going to see similarly no motion up above where the chest wall is, but then you're also going to see no motion down below where the lung is. This is called barcode sign, where you've basically just got straight lines going all the way across, demonstrating an absence of motion in the lung. Here what you see on the left-hand side is the video of a lung which is not collapsed, or a normal lung, and you can see the visceral and parietal pleura shimmering back and forth relative to one another. Some people call this ants marching on a hill, but you can see that that visceral and parietal pleura are moving relative to one another. Versus the image on the right, in contrast, you can see that this region of the lung between these 2 ribs is not moving and that there's a pneumothorax present.